Good afternoon. My name is Mike Tempelhof. I'm an interventional cardiologist with OhioHealth Heart and Vascular Physicians. I work at Grant Medical Center. I'd like to take this opportunity to review a case that highlights the pre-hospital STEMI alert protocol, and in particular the pit stop protocol, which has recently been implemented by OhioHealth. This case particularly highlights how the brief pit stop in the ER will save lives if implemented appropriately. And also to add the caveat that the pit stops have not, and the data has been shown to not have any implications on our 90-minute to door balloon time. Our average pit stop thus far has been roughly around 3 minutes or so. But the importance to walk away from this video is that the pit stop, if implemented correctly, can save lives. So recently, while on call, the cath lab and myself were activated by the emergency room for ST elevation MI. It was an appropriate activation. There was clear ST elevation in the inferior leads. A 48-year-old female with sudden onset of chest pain for approximately 24 hours or so came into the emergency room, and following the appropriate pit stop protocol, met the patient downstairs and the ED physician, discussed with all of the personnel surrounding the details of the case. And the pit stop allowed us the opportunity to all conclude that although it was ST elevation, there perhaps could be other etiology or other confounding issues to the patient's presentation. So at that point in time, the cath lab was put on hold, the patient was stable, and a stat bedside echocardiogram was completed. The echocardiogram was completed and ordered because there was an elevated white count and the patient's history of IV drug abuse. So without further ado, I'll show you the images that were acquired at bedside and confirmed the team's suspicion that this in fact was not a clear-cut STEMI. Here I'm pausing the video, and this is the left ventricle, and this is the mitral valve separating the left atrium from the left ventricle. And normally this should look like a clean piece of paper, essentially, one plane. And as I scroll through, you see this very large mass here, which is actually infective endocarditis. It's a vegetation of bacteria that has colonized and grown on the mitral valve here. Now, more important to this case, and why the pit stop saved this patient's life, is that there's another mass you see here coming in and out of plane that is right in the LVOT, the left ventricular outflow tract, which separates the left ventricle from the aorta here. And on subsequent views, we're able to discern that this vegetation, another bacterial growth, was actually on the aortic valve and in the ostium of the coronary artery. And so hence that was causing the obstruction to the coronary artery and the ST elevations. Now, as I pause one moment to show you this in more detail, why is this case highlighting the importance of the pit stop is that doing a left heart catheterization, especially urgently off hours, the catheter would come up into the aorta. So if you're looking here, this is the aorta. Here is the aortic valve. This is now the aortic valve put into a different plane. So we're flipping and looking at it simultaneously. And the vegetation comes in and out of plane. You may not be able to see it all that well, but it's right here. And in fact, you could see a coronary artery right here in this trajectory. During the heart catheterization, a catheter is placed here on top of the valve, which is right where the vegetation is located. Doing that procedure in this situation would have been detrimental to the patient's health, in that most likely would have led to a significant and catastrophic stroke. Strokes have a significant mortality associated with them. In fact, it's higher than that's associated with a myocardial infarction. So this highlights that doing a catheterization urgently without all the appropriate data actually would have had a catastrophic result. And this patient, I'm happy to say, has actually gone on to receive all the appropriate therapy Still remains in the hospital today, prolonged hospital course, but is doing very well and actually will be discharged shortly in good health because she did receive all the appropriate care. So I want to thank you for your time and to really keep this case in mind when coming to the emergency room and asking potentially if there is something else, more detail that needs to be collected before proceeding urgently to the cath lab, because we always want to do what's best for the patient and never ever invoke any harm. So thank you for your time, and I look forward to working with all of you in the future.